Step number 2 is dealing with the inflammation. It doesn't really matter what particular problem we're talking about. Arthritis, tendinitis, bursitis, even a pinched nerve, there's some degree of inflammation that is a part of that problem. And that inflammation is usually not only painful, but it interrupts and disrupts the healing process. So reducing that inflammation is an important component of the treatment process. Now there's a variety of different ways that we can treat inflammation or reduce inflammation. Probably the most common one that most people are familiar with is simple over-the-counter anti-inflammatory medications. That would include things like Motrin, Advil, ibuprofen, Aleve. All of those are anti-inflammatories. So taking something like that can help reduce the inflammation in the shoulder, help minimize the pain, and frequently will help improve the motion and the strength in the arm. Now, one of the common problems that I see is inconsistency in using the medication. People may take it for a couple of days, they start to feel better, then they stop taking the medicine and they think that everything's behind them and they try to go back to their activities. The shoulder hurts again, they go back to taking the medicine for a couple of days, and it's this constant back and forth. You will get much better relief from using the medication on a consistent basis. It's difficult to say how long that is because every situation is a little bit different, but in general, 2 weeks is probably a good time frame for taking an anti-inflammatory on a consistent basis. Now, there are some things that you have to be aware of. Anti-inflammatory medications, all of them, can cause some side effects. The most common ones being heartburn or indigestion, upset stomach, that sort of thing. So if you're experiencing that, you may need to stop taking the medicine and talk to your doctor about what other options might be available for you. There are certain medications or medical conditions that you probably need to be aware of. If you have a heart condition, if you've got kidney problems, if you're on a blood thinner, or if you're taking several other medications, it might be a good idea to check with your doctor to make sure it's okay for you to take anti-inflammatories. But in general, for short periods of time, most people can tolerate over-the-counter anti-inflammatories without any real problems. The second problem that I see is people taking more than one anti-inflammatory. They don't realize that all of these different medicines are basically doing the same thing. All of those that I mentioned before, Advil, Motrin, ibuprofen, and Aleve, also naproxen, all of those are basically the same thing. Now the dosing is a little different. How often you take it may vary from one drug to the other, but they are basically doing the same thing. So you shouldn't take several different medicines that are similar over the course of a single day. I see some people will wake up in the morning and they'll take one, and then they'll take something different around lunchtime, and then they may take something else different again in the evening, and they think that they're spreading things out and taking a low dose of each one, but what they're really doing is making it hard to keep track of how much of the anti-inflammatory that they're taking. So it's best to just pick one. Whichever one you want to start with is fine, but take that one consistently for a couple of days and see how effective it is. If it works well, then continue taking it, but if it's not working, then maybe try a different one for a few days and see if something else might work better. So consistency, but also making sure you're not taking too much of it. Those are two important factors with the anti-inflammatories. Now, there are other options available for anti-inflammatories. Some people can try topical applications, essential oils or certain balms or creams that you rub on over the area. They can get absorbed through the skin, and that can have some anti-inflammatory effect. There are even certain diets that are supposed to be anti-inflammatory, or certain herbs or supplements that you can take. Now, I'm not an herbalist or a nutritionist, so I can't give you any particular details about that sort of thing, but I have had patients that have told me about those things and have expressed some satisfaction with the results that they've gotten. So if that's something that you are interested in or more comfortable with, then that certainly is worth looking into. Now, as a physician, one of the things that I use frequently, what I would consider the silver bullet, or the big daddy of the anti-inflammatories, is a cortisone injection. Now, cortisone is very similar to a drug that your body naturally makes called cortisol. Your body makes it in response to stress and injury, and it's part of the healing process. Well, in medicine we use cortisone to mimic some of those same effects. You've probably used cortisone in some form or fashion. You can use it for poison ivy. You can use it in a topical form as hydrocortisone cream for a rash. And all of those are basically versions of cortisol. With shoulder pain, one of the things that we can do is provide a cortisone injection in the shoulder, right where it hurts, and that can be very effective at reducing inflammation, can help considerably with the pain, improves motion, and overall can help kind of turn the corner to get you on the road to recovery. Now, people have a lot of questions and sometimes what I would consider misconceptions about cortisone. The first being, don't you have to keep doing those over and over again? That's not true at all. If a single cortisone injection works, then you're done. You don't have to keep doing them over and over and over again. There are some medical problems that are ongoing problems that aren't going to go away, and using cortisone repetitively for a long period of time sometimes is used in those situations. But if you have an isolated problem, say tendonitis in the shoulder, and the cortisone resolves it, then you don't have to keep doing anything else beyond that. The second question is, isn't cortisone bad for you? And I have a lot of patients that are concerned about that. That's probably, again, what I would consider a misconception. Too much cortisone can cause problems. So we try to limit the frequency of the injections. We use a very small dose, and we administer it only in the areas where we think it's going to be effective. So we don't use cortisone for every ache and pain in the body. We use it for very specific problems, but when it's used properly, it can be very safe, very effective, and it's not something that you have to do repetitively for a long period of time. So that's phase number 2, is treating the inflammation. Again, whether that's oral, topical, injection, whatever works best for you.